Amravati Singh is a 74-year-old female, elderly female, who had come to us from Gorakhpur, and she was having severe pain and deformity in both knee joints with severe arthritis.
She was on bed, not able to walk, stand. Even we had to support her for her daily rituals.
She had multiple comorbidities like diabetes, hypertension. She had obstructive sleep apnea, difficulty in breathing, and above all, she was quite obese. With all these comorbidities and with the continuous pain, she was not seeking proper treatment and was denied surgery at multiple places.
And finally, we were given a name of Dr. Nikunj Agrawal by one of my colleagues. When I met Dr. Nikunj first time, I was really impressed with his professionalism, his approach towards the patient in listening patiently, understanding the issue and problem.
Usually such cases who are completely bedridden for 5 years are quite challenging because there is severe weakness in the bones over a period of time. The muscles also get weakened. There are contractures which develop in the knee joints, and it becomes overall difficult. Surgically also it becomes much more challenging to treat such cases. Most of the investigations were outside the normal parameters. We tried to normalize and optimize the patient, and after obtaining the anesthesia fitness, we decided to go with the staged surgery. So we did both the knee joint replacements in the interval of 1 week. After the surgery, patients felt quite better and started with rehabilitation and physiotherapy.
Within 7 to 10 days, she started walking. Within 2 weeks, even along with all those complexities and health issues, she is able to perform her daily rituals on her own.
Patient is now 1 month post-surgery, and patient is able to walk pain-free and comfortably with the help of walker. Going forward with proper rehabilitation and physiotherapy, patient will be able to walk more confidently and independently.
मैं अपने आप को बहुत बेहतर फील करती हूँ। पहले मैं जितना दर्द से परेशान रहती थी, उससे ज़्यादा से ज़्यादा अच्छा फील करती हूँ।
I'd like to thank Dr. Nikunj Agrawal from Max Vaishali. We found the administrative staff, the nursing staff, very cooperative and supportive. They were always there when we needed.
Patients who are bedridden for 5 years or more should not shy away or should not be scared from surgery, and they should get the right treatment from the right place so that they can change their quality of life and ultimately can have a good quality and prolong their life.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.